Hi, my name's Chris. I'm one of the vets from the internal medicine team, and we're going to do a little video on how to use an esophageal feeding tube. So an esophageal feeding tube is a tube that we place and it just goes through the skin just in the side of the neck. And what the tube does is it basically bypasses the mouth. So what we can do is we can give liquid food down the tube so that we can get calories and nutrition in, and sometimes give medications and other things. We'll use these tubes often in patients who've had an illness where they may not want to eat, where maybe they have some problems with their, with their mouth or jaw and they physically can't eat, or where it's, sometimes easier for giving medications and hastening their recovery. With this tube, it's a very intimidating thing to hear that you need to use a feeding tube. But what we find is that they tolerate it extraordinarily well. Most dogs don't really mind it at all, and all they can feel is that they have a little bandage around their neck. With the tube, after a few goes, you'll become a bit of a pro. And what we want to do is we want to just make sure that we take some precautions to make sure that we don't have any complications. So whenever we use this tube, there are a few steps we need to go through to make sure that it's in the right place, and then feed in a way that is safe for everyone involved. The first step with the tube is that we make sure it's in the right spot. So what we want to see is that this tube is where it's been the whole time. So the tube is stitched into the side of the neck, and so what we want to do is we want to have a look under the bandage and say, yep, the stitch is still intact, it's still stitched to the skin, and the same amount of tube is hanging out as what there always has been. If there's more, then what we want you to do, or if the stitch is undone, is we want you to wrap it up and give us a call at the clinic here. What we want when we're feeding is we want for our patient, our dog or our cat, to be sitting upright and awake. So you don't want to be trying to swallow food when you're asleep, it's a bit risky, so you need to be sitting up and awake. With the tube, so the tube comes with a little cap. Every now and then we find this cap becomes a little bit weak over time. And if it does, then what we may need to do is just replace it. The cap can come off, and what we want to do is have everything ready before we do the feed. And so what we need is we need an empty syringe, we need a syringe full of water, and we need our food. Now the food should be warmed up to room temperature, but what we don't want to do is have it too hot. So it's really important we don't ever put the food in the microwave. And it's really important we make sure that it's just at a room temperature. And what you can do is warm it up in a water bath or prepare it fresh at room temperature each time. Once we have the tube, we remove the cap and we take our empty syringe and we put the syringe on. What we're doing here is we're checking for negative pressure. Negative pressure means that the tube is in the right spot. If we draw back on the syringe and we get lots of air, it means that either there might be a hole in the tube, or otherwise it means that there could be the tube has been coughed up and in the wrong spot. So what we do is we draw back on the syringe and we let it go and see that that sucks it right back down. So that's what we call negative pressure, is that it sucks back down, and that means our tube is in the right spot. Sometimes you might get just a tiny bit of water or air, but then you should get that negative pressure afterwards. Once we're happy that it's in the right spot, the next step is to put some water down the tube. When we put the water down the tube, we want to see that it flows freely, and we want to see that there's no coughing or spluttering at all. Some dogs will do a little bit of a swallow, just like they're swallowing normal food or water, and that's fine, but any coughing, we want you to stop and let us know. We take our syringe of water. Hang on, mate. Come around this way. Come on. Can you sit there? So we take our syringe of water and we connect it. And what we want to do is just push it down gently and see that the water is going down gently. And we want to do about 5 mils of water to know that it's going down normally without any coughing or concerns. After we've administered the water, what we then do is we use our food. Now the food should be thin enough to draw up through the syringe, and if you can draw it up through the syringe, then you can push it out through the syringe. This one wants the food by mouth. And so we attach our syringe of food. Oop. And we want to inject that slowly, and so we don't want to do it too quickly at all. And so what we would normally do is inject the food over about 15 to 20 minutes. If there's any regurgitation or coughing, again, stop feeding and give us a call here at the clinic. After we've injected the full volume of food, which will depend on the instructions from your vet, we then want to flush the tube with water again so that the food doesn't dry inside the tube. If the food dries inside the tube, it can mean that sometimes then it's harder to use. So we connect our water again, and we give it a push of 1 to 2 mils at a time, and we want to give a total volume of 5 to 10 mils. And that'll depend on the size of the tube. But what we want is for it to feel like it's pushing down really nice and easily. Once we're happy the tube is flushing nicely, we disconnect and we put the cap back on, and then we tuck the tube back in underneath the collar. One complication we can see with these feeding tubes is that where the tube goes in through the side of the neck is you can get a little bit of irritation, just like any wound. And so sometimes that can become infected, and very rarely you might see what looks like some food come up through that hole as well. We want to check that daily, and we'll change the bandage either once a day or sometimes down the line only every few days, but we do want to check it once a day. If there is any discharge there, then we'll normally give you some solution to give it a clean. If you're really worried, if it looks like there's any yellow-green discharge, if it smells or it looks really inflamed, then we'd really like you to give us a call and let us know.